Mouth breathing is the act of inhaling and exhaling primarily through the mouth rather than the nose. While it's a natural response during physical exertion or when the nasal passages are congested, chronic mouth breathing can have various implications on health and well-being. Nasal breathing is the body's preferred method of respiration. The nasal passages are equipped with tiny hairs called cilia and mucous membranes that filter, warm, and humidify incoming air. This helps to trap dust, allergens, and pathogens, preventing them from entering the respiratory system. In contrast, mouth breathing allows unfiltered and unconditioned air to enter the lungs directly. This can lead to irritation and inflammation of the airways, making individuals more susceptible to respiratory infections and allergies. Mouth breathing can cause dryness in the mouth and throat since it bypasses the moistening effect of nasal passages. This can lead to bad breath and discomfort. Chronic mouth breathing can alter the oral environment, leading to dental problems such as gingivitis, cavities, and malocclusion, which is the misalignment of teeth. Mouth breathing is often associated with sleep disorders such as snoring and obstructive sleep apnea. In these conditions, the airway becomes partially or completely blocked during sleep, leading to disrupted sleep patterns and daytime fatigue. Prolonged mouth breathing, particularly during childhood when facial bones are still developing, can affect facial structure. It may result in long, narrow faces, dental arch abnormalities, and changes in the position of the tongue. Mouth breathing is often associated with sleep disorders such as snoring and obstructive sleep apnea. In these conditions, the airway becomes partially or completely blocked during sleep, leading to disrupted sleep patterns and, well, daytime fatigue. During physical activity, nasal breathing helps regulate airflow and maintain optimal oxygen-carbon dioxide exchange. Mouth breathing, on the other hand, can lead to inefficient breathing patterns, decreased oxygen uptake, and reduced exercise performance. Allergies, sinus infections, nasal polyps, or anatomical issues such as a deviated septum can obstruct nasal passages, forcing individuals to breathe through their mouths. Some individuals develop a habit of mouth breathing, especially if they have experienced chronic nasal congestion or if they have certain anatomical features that make nasal breathing difficult. Conditions like sleep apnea often result in mouth breathing during sleep due to airway obstruction. Treating conditions such as allergies, sinus infections, or structural abnormalities can help improve nasal breathing. Encouraging conscious nasal breathing during waking hours and utilizing techniques like nasal saline rinses or nasal strips can help retrain breathing habits. Orthodontic treatment may be necessary to correct dental issues resulting from chronic mouth breathing. In cases of severe sleep disorders like obstructive sleep apnea, continuous positive airway pressure or CPAP therapy or surgery may be required.